I got broads in Atlanta, just to throw me in the family. Credit cards and the scammers, hitting the licks in the band. Legacies.
Washes hands before the procedure. Provides privacy all throughout the procedure. Perform the physical examination efficiently and unhurriedly. Prepare clients psychologically for the examination. Finish procedure in 20 minutes. Explain the procedure and rationale of the examination to the chart. Ask the client to empty the bladder or bowel before the procedure. Observes the general appearance of the client. Let client assume a sitting position. Measures the size, circumference of the head with tape measure. Inspects for the presence of pediculosis or dandruff. Describes deformities, lesions, swelling, mass, hair texture and color of the head. Notes visual acuity by having client read Snellen chart with index card covering the eye one at a time. This is 20 feet away from the chart. Observes reaction of the pupil to light by using pen light in a darkened room. Inspects the eye for any inflammation, conjunctivitis, eye movement, appearance of eyebrows and globes protrusion. Inspects iris color. Inspect the auricle, color, symmetry, size, and position. Palpate the auricle for texture, elasticity, and area of tenderness. Visualizes the tympanic membrane using otoscope.
Tuning fork tests are useful in assessing hearing loss. This video shows how to perform Rinne and Weber's tests. These tests are performed using a 512 Hz tuning fork. The tuning fork can be activated by flicking it between your fingers or by tapping the tuning fork on the knee. It is important to explain the test clearly to the patient.
So you're going to hear a buzzing. I want you to tell me which position it is louder in. So position A.
This tests air conduction.
Or position B.
Bone conduction is tested by placing the base of the tuning fork on any bony area surrounding the ear. When testing air conduction, the tines of the tuning fork should not be held parallel to the external auditory meatus. Instead, they should be held perpendicular to the external auditory meatus and about 1 centimetre from it. Again, it is important to explain the test clearly to the patient.
So can you tell me whether you hear the sound loudest in your left ear, your right ear, or whether you can hear it in the middle?
Place the base of the tuning fork in the midline.
Middle.
Gently occludes one nostril at a time and ask the patient to breathe through the non-occluded nostril. Inspects the presence of lesions, swelling, and discharges on the nose of the patient. Observes the lips for its color, texture, hydration, swelling, and lesion. Inspect the gum for color, edema, bleeding, and lesions. Inspects the neck for symmetry, edema, masses, or scars. Ask the client to extend neck and swallowing noted. Describe the symmetry and contour of the chest and back. Inspect, palpate, and percuss the chest. Take note, avoid unnecessary exposure of the breast of the patient. Listens for the breath sounds and identify any sudden sound. Listens to the heart sound or any murmur and check apical pulse using the bell of the stethoscope. Ask the patient to lie in supine position and raise arms over the head. Inspect the size, symmetry, and contour of the areola of the patient. Palpates the breast and nipple for presence of mass, tender areas, and any discharges. Palpate the axilla and feel for nodes. Palpate the supraclavicular and intraclavicular areas and feel for nodes. Assess the general contour of the abdomen. Auscultates the abdomen to assess presence of quality of bowel sounds. Percuss over the stomach and intestine to detect the presence of air. Palpates lightly, then deeply to feel the underlying organs. Examines visually the male genital for any enlargement of the scrotum, testis, penis, cleanliness, any lesion, and discharges. Pinches skin of the extremity for the test of skin turgor. Notes for any skin pigmentation, lesions, and scar. Asks client to squeeze the examiner's finger to assess muscle strength. Converses with the client asking questions about the events or any concerns about any health problems. Performs all sensory testing with client's eyes closed. Strokes the client's skin with cotton wisp. Strokes skin with safety pin, altering blunt with sharp end, and may also touches client with test tube filled with hot water and another test tube with cold water. Taps tendon briskly with reflex or percussion hammer.